In the past, we've had surgical type options to deal with keratoconus in extreme cases. So we're talking about corneal transplants. And that's what most people think of when they think of surgery interventions. And I guess corneal cross-linking is it surgery? It's a procedure. It's a surgical procedure, but it's not surgery per se. It's certainly not a transplant. And what they do is they basically douse a cornea with vitamin B12, and they douse it over a period of time so it gets absorbed into the cornea. And then they illuminate that cornea, that eye, with a level of ultraviolet light for a certain length of time. And these are all prescribed with the different protocols that are followed. And what that does is it creates internal cross-linking. So imagining that we've got reinforcing bonds being built all the way through the structures of the collagen fibers of the cornea. And it makes it much stronger, makes it less likely to distort or become conical or progress. So when should we be doing that? Any evidence of progression in your late teens or 20s or 30s, you want to be doing that as soon as possible. Because what does it prevent? If it's early stage keratoconus with signs of progression and that stops the progression, then you don't progress to ever needing a corneal transplant. You stop the almost reduce to nil the chances of you needing surgical intervention. If that happens later and there's a much more advanced keratoconus, then the cross-linking can hold things at bay, and it may still lead to a transplant, but it theoretically is not going to get any worse over time. Mm-hmm. So my thought on that is, again, earlier checkups, earlier interventions, earlier diagnoses lead to earlier referrals for cross-linking, which is a first line of defence. If you speak to a couple of corneal fellows, they talk about cross-linking, meaning that they're not going to be doing transplants for most keratoconus patients going forward, which is amazing.
And so just to be clear, that the corneal cross-linking is a something that you'd go to an ophthalmologist for, not your local optometrist.
No, definitely. Yeah. So it's something that you'd go to your optometrist to see if that would be something suitable for you. And then with that, you'd get an answer yes or no, and you'd be referred to a local specialist to talk about doing the cross-linking. Right. I tend to use corneal surgeons to do cross-linking for most of my patients, but there are a number of ophthalmologists that are not particularly corneal surgeons that are doing cross-linking in Hobart. And I think you'll find that all over Australia. But my preference is always to deal with someone that specialises in the cornea. That's the person I want doing the cross-linking, because they're the ones that are going to deal with any aftermath of something going, not to plan or anything else of that sort of nature. So
and also, correct me if I'm wrong here, but if somebody is in a situation where they do need a cornea transplant, that cornea isn't necessarily going to see them out for the rest of their life, is it? They may have to come back for another transplant in the future. What's the situation?
They can do, yeah. With something like a keratoconus transplant, if it lasts for so many years and they have to do another one, they can do. Yeah. Whereas if you've got a degenerative condition that's an infection or something nasty or then those people, they may not survive a second transplant. So so it's a bit tricky. But I've got some data for you on that too, if you like. So sure. This is some recent data that's been released as well. 98% of grafts for keratoconus are likely to survive the first year. So that does mean there's a 1 or 2% chance of a graft not working straight away, within the first year. 3/4 of grafts survive between 5 and 15 years, still maintain better than 6/12 vision. 6/12 vision is the legal to drive requirement. Mm-hmm. So we're talking about 75% of eyes maintain that vision between 5 and 15 years.
Right.
Which is pretty reasonable.
Yeah, it's pretty good odds.
And the other thing to remember is the majority of people that have grafts will still wear glasses or contact lenses. Right. And a graft, there are special types of contact lenses that are post-graft contact lenses, like reverse geometry, are hard cornea lenses that I used to fit extensively in Queensland. And they're designed in a certain way to fit over an unusual cornea, like a grafted cornea. But that's also where scleral lenses come into their own. So scleral lenses are a great way to get the best vision possible from a grafted eye.